Lung patterns. The lungs are the site where internal and external qi is exchanged. Their primary functions include managing qi, breathing, dispersing, and descending. They gather the 100 vessels to aid the heart, shin, in its blood-pumping function and regulate the water passages to facilitate the transport, distribution, and metabolism of fluids. Additionally, the lung qi, fei qi, manages protective qi, wei qi, dispersing external pathogens and protecting the body. When the dispersing function of the lungs fails, they cannot effectively expel pathogens. If the descending function is impaired, it can result in coughing and edema. Furthermore, when the lungs fail to adequately manage qi, it can lead to general qi deficiency, affecting the overall energy and vitality of the body. The lungs are located at the highest position among the organs and take charge of the first line of defense. Due to their close relationship with the external environment, the lungs are particularly susceptible to the influence of external pathogenic factors, such as wind, cold, and heat. Therefore, the 6 external pathogenic factors, wind, cold, heat, collectively contribute to the development of respiratory problems. It is important to recognize that the wind-cold invading lung pattern is not just organ pattern. It is more comprehensible to perceive this condition as a pattern induced by the external pathogenic factors. Lung patterns are mainly expressed through respiratory symptoms. These are symptoms of cough and dyspnea. Problems related to breathing, voice, cough, and phlegm, respiratory. Exterior invasions of wind, infection. Empty and full pattern of lung, empty, qi deficiency, yin deficiency. Full, damp phlegm, heat, phlegm, wind, cold, heat, water. Simply put, lung qi deficiency is a combination of qi deficiency symptoms and cough, while lung yin deficiency is a combination of yin deficiency symptoms and cough. Shortness of breath, dyspnea, is characteristic of qi deficiency, while dry coughing is characteristic of yin deficiency. Lung qi deficiency equals sign coughing plus qi deficiency, shortness of breath, weakness, plus white phlegm. Lung yin deficiency equals sign coughing plus yin deficiency, empty heat, dryness, plus no or sticky phlegm. All excess patterns are respiratory phlegm patterns, characterized by nausea, dizziness, respiratory stuffiness, and sputum as common symptoms. They can be divided into damp phlegm retention in the lung without heat signs and abundant white sputum, and phlegm heat retention in the lung accompanied by heat signs. Phlegm heat retention in the lung can be seen as a chronic form of the wind heat invading lung pattern of external invasion. Damp phlegm retention in the lung can be seen in conditions like COPD, while phlegm heat retention in the lung can be seen in symptoms of bronchitis, pneumonia, etc. Lung patterns include patterns caused by external pathogens. There are invasions of wind cold and wind heat, and a special case of wind water invading the lungs. Wind water. Invading the lungs is a pattern characterized by external invasion symptoms, cold-like symptoms, along with facial edema. Large intestine pattern, cold and heat, damp heat, cold diarrhea, heat constipation. For the large intestine, there is damp heat in the large intestine for heat patterns, heat obstructing the large intestine for excess heat, and cold invading the large intestine for cold patterns. Damp heat in the large intestine refers to dysentery diarrhea accompanied by heat signs, while heat obstructing the large intestine refers to constipation due to yang ming fu excess. Cold invading the large intestine means acute abdominal pain and diarrhea caused by excess cold. Damp heat in the large intestine and cold invading the large intestine are cold and heat types of acute excess diarrhea, while heat obstructing the large intestine is acute excess heat constipation.